Welcome to the Maimonides Medical Center joint replacement video. I'm here as a joint surgeon to teach you a little bit about what you're going to go through in the next couple weeks to months. You will meet physical therapists, anesthesiologists, caseworkers, and some joint surgeons. You will also be meeting one of our patients. He will be able to explain to you how he went through the process and how well he did afterwards. We're here to make your hospital stay as well as your transition to home as easy as possible. Joint replacement surgery is one of the most successful surgeries that we have in orthopedic surgery. This also allows patients to spend time outside, enjoy sports, and do things that they hadn't been able to do before. A lot of these patients have been in pain for many years, and they come out of this whole process very happy. Let's take some time to meet some of our surgeons.
Maimonides Medical Center is the place for total joint replacement in Brooklyn. We have excellent medical team, including doctors, nurses, physical therapists. We all strive to bring you back home after surgery. We will make sure that you meet all your needs before you leave the hospital. For example, let's say if you have to walk stairs at home, we'll make sure that you will have stairs training in the hospital. Eventually, when you get home, you feel comfortable. You will have your home physical therapist with us, as well as the home nurses to come see you at home.
Hi, I'm Dr. Joseph Felicia. I can tell you, I've been practicing for over 35 years. I have a relationship with patients that I feel is significant. I'm able to discuss issues with regard to joint replacements. I'm going to tell the patient what the surgery is about, what the surgery will mean to them, what a realistic outcome will be, and come up with a treatment protocol to get the patient functional after the surgery in the shortest period of time.
My name is Dr. Victor Sasson. I'm one of the orthopedic attendings in Maimonides Hospital. I do perform a significant amount of joint replacements. We have a whole team approach in the Maimonides Hospital. I'm very comfortable operating in Maimonides Hospital. I think the nursing staff is excellent, the operating room staff is excellent, and the post-operative care is excellent. Patients are quite happy after they leave the hospital and during their length of stay during the hospitalization.
I believe optimally patients should go home with home physical therapy. Physical therapy and home care services have dramatically improved over the past few years. Most patients recover best in their home environment, which is a protected environment, safe, with the least possible complications associated with infection.
We work with an anesthesia team that's there with you before the surgery, during the surgery, and after the surgery.
Hello, my name is Gary Schwartz. I'm an anesthesiologist and the Director of Acute Pain Management at Maimonides Medical Center. My job is providing pain relief to patients before, after, and during surgery for total joint replacements. One of the most common questions we get asked is how is our pain going to be managed before, after, and during surgery? Usually we give our patients a cocktail of medications prior to undergoing their joint replacement, including a multimodal analgesia. Multimodal analgesia is the process of giving a few medications to help relieve patients' pain while minimizing the side effects. Prior to going in the operating room, your anesthesiologist will talk to you, and then they will discuss giving a spinal anesthesia. What that entails is numbing the lower half of the body for your joint replacement by injecting some local anesthetic into the spinal fluid, not into the spine itself. That does not mean you're not going to be awake for the surgery. The anesthesiologist will sedate you for the procedure, but you will have no pain from below your abdomen area, so you can recover from your total knee and total joint. After that part of the procedure, the anesthesiologist will place a nerve block to block the nerve of your knee or your hip to decrease your pain after the surgery. From that point on, you'll go to the recovery room and our acute pain team will follow you while you're in the hospital to make your stay comfortable, allowing you to get up faster from surgery, wake up faster, and get back to your normal routine. We will then assist the surgeons after the procedure to give you medications on the way home so you could recover in the comfort of your own home.
Following surgery, you'll meet some of our wonderful nursing staff. They'll be able to transition you to the next step.
Hello, my name is Ilana Fuchs. I'm one of the staff nurses on the orthopedic unit here. We strive for safety pain control, and to get you back to your daily life as soon as possible.
Hey Mary, how are you? I'm Fabio. So basically this unit is a unit that after you have surgery that you come to recover.
Right.
All the patients that have any sort of surgery on their hips, on their knees, or any kind of fracture will come here afterward.
Okay.
Our usual plan of care is, first of all, to control your pain. One very important aspect of your recovery is to get you up and about. We try to do it same day if possible. Other than that, we guarantee you to get out of bed the next day.
My goal is to make them feel comfortable, secure, and confident with me, because I think that's what helps the healing process.
Every Monday we have a comprehensive joint replacement class. That is for a patient is scheduled to have a joint replacement. They come to observe the hospital. They're going to look at the stay, where they're going to be staying, the rooms they're going to be staying, what kind of care they're going to be provided, what their expectations are preoperatively and especially postoperatively.
What I'm going to discuss today is what to expect when expecting surgery. So they will call you the night before usually to let you know when your surgery is going to happen. You will come in, you'll be prepped, you'll go in for your surgery, okay? Hi, my name is Alexander Gross. I'm a senior physical therapist here in Maimonides. My role is to get you up and moving as soon and as quickly as possible so that you can have a speedy recovery. They're usually lying in bed, and we take their blood pressure, we make sure they're okay, and then we start to begin the process of teaching them how to get up out of the bed, how to stand properly, and then how to then start walking and introducing weight to the joint that they've had replaced.
This is called a trapeze. This is attached to your bed. After you have your total joint surgery, you're going to be using this device to help yourself in the bed, whether it be to lift yourself up to put a bedpan or lift yourself higher in the bed. This is going to help with mobility in the bed.
The day of surgery, we call it like post-op day 0. The same day, 2 hours after we leave the OR, we walk our patients. It's very important for us to walk the patients to give them a very strong psychological support that they can actually walk after surgery.
They should expect to be working with physical therapy very diligently, moving their new joint, introducing movement to their new joint, start on working on range of motion at the joint, and then progressing to strengthening of that joint.
Home care services, the nurse is going to come to your house. She's also going to assess your house.
Case managers will be an integral part of transferring you from the hospital to your home.
My name is Esther Wallace. I'm the nurse case manager. Following your procedure, I will be discussing with you what to expect when you go home. We will try our best to have every service in place, whether you need physical therapy, whether you need a home attendant, a nursing to see you at home. We will make sure you get the equipment and everything you need to make sure that you are safely transitioned to your next level of care. What we like to do here is almost immediately following, we will start planning discharge so that the patient and the facility have enough time to properly have services in place. We'll get an idea of their home and their living environment. We'll get an idea from the doctors, from the medical standpoint, what they need once they're discharged. And we can also check with their insurance to see what they're able to get and what we can get them.
The best place for a patient to recuperate is in a comfortable environment. An environment where he's not exposed to pathogens, bacteria. Your body is quite comfortable living in your home environment.
I emphasize home care because going home, first of all, they're more comfortable going home. It's their own place. And second of all, we send them our nurses and our physical therapists have one-on-one care with them at their home for almost 80% of the stay for the first 2 weeks at home. From my experience, patients truly enjoyed it compared to patients who go to rehab.
With advancements in joint replacement surgery, we've learned that patients do better by going home. We're able to get you more comfortable, as we'll have people to assist you when you're there. You'll be meeting Arthur, one of my patients today, whose #1 goal was to get back to riding a bike.
My name is Arthur Hovden. I'm a successful patient of a total hip replacement. I went online and I found Dr. Eretz and I heard him speak on a short video. I made an appointment, and when he walked in, I was very pleased. Having this fear, I needed somebody to make me feel comfortable. And he worked with me from the beginning. He asked me what my issues were, and he made me an appointment that he found very soon, so I didn't have to wait. When I went in that morning, I was there at 5 o'clock, and we prepared. I had some strength. I did view the operating area, so I felt comfortable. I knew where I was, and I was able to go through with the surgery. And I felt confident because I know I was always a strong individual. One thing that really pushed me over to accept the surgery, he said, "I'll make a deal. If you can walk the next morning, I'll let you go home." Because I was anticipating a long stay in the hospital. So I kind of hinged on that. It helped me, and the way he was willing to work with me. The morning came. The next morning I was home by 1 o'clock. The woman in charge of the walkers, I guess the rehabilitation, come up and gave me a walker, and she asked me to walk to the desk there where all the secretaries were. Man, did I walk there, and I walked back quickly. I probably covered about 60 feet, and I was successful because the word I asked, the question I asked this woman was, "Are you sure I can walk on it? I fear it's going to break or something like that." And she says, "You know, a lot of people ask me that to trust the operation, but boy, it's held up. The fact that I can have home cooked meal, and my sons come over, and I watch some television, and I was glad. I was proud of myself. I was able to endure the situation. Then I would come for a periodical checkup. Every 6 months, I think it was, and I had some questions. You know, how long is some of this little pain is going to work, or when can I get the normal swing in the step when you walk? It comes. I was walking with a little moderate pain, say for if I do 10 or 15 blocks or something, go to the hardware store. You know, you have a little something to deal with. A little over 2 years now, and I'm walking nice stride. Find somebody you feel confident with. Don't be afraid to ask questions. Perhaps even give me a tour of the hospital area. Can I feel comfortable? Ask questions. Ask, well, this bothers me or that bothers me. I never looked back after the surgery. I was riding a road bike in 8 weeks. Now I'm doing 150, 200 miles a week as I always did. I think you'd be doing yourself a good service if you choose to want to feel well again. It is possible. My family was proud of me. I was proud of myself. There's no reason to live with this pain. You have to help yourself a little bit after surgery, but I think you'll be very happy with yourself. It's an investment in your well-being.
Now that you met our team, I hope that we've been able to allay some of your fears and educate you about the process that lays ahead. Joint replacement is a very successful surgery that takes time, effort, and a coordinated team. We're here to work with you through this process and have a successful surgery.
I've always had a concept that the people of Brooklyn deserved a better place to get their orthopedic care. I was born in Brooklyn. I was born at Maimonides Medical Center. I absolutely love Brooklyn. There's no place like Brooklyn in the world. People in Brooklyn are a unique group, and I think the group we have here fits that perfectly well.
So I'm actually a native New Yorker. I was born and raised in Queens. What I loved about orthopedics specifically is that you can make a tangible difference in someone's life, and you actually see your result fairly quickly.
I want to make patients better, truthfully. I really want to see patients that weren't walking or having trouble walking, walk again. I want to see patients that play sports and can't play sports because they injured themselves, go back to their sport. So that's one of the most rewarding things that I have.
When we treat patients, we're not just treating an x-ray, we're not just treating what we see or an extremity, we're trying to treat the whole patient.
I think that's very important. Bedside manner is how you connect to the patients.
There's not one patient that can come in here and not feel like they're at home and feel like they can get the care they need. We're very sensitive to cultural demands of our communities, and I think that's what separates us from a lot of other practices.
This is the only facility where we provide both orthopedic care as well as spinal care in Brooklyn.
Pediatrics, trauma, reconstructive surgery, oncology.
And what we're trying to create here is kind of a one-stop shop for orthopedics.
It's a very pleasant, modern, clean, happy, bright place.
A full team covering pretty much every aspect of orthopedics and sports medicine.
I feel the facility is excellent. We offer a very good quality of orthopedic care.
We strive to be the best in New York at what we do. We like to focus on patient care and want to make sure they understand what's going on, and more importantly, that they're part of the process.
The Bone and Joint Center is an all-inclusive, comprehensive center for all of your orthopedic care.